Good afternoon, everybody. I'm Dr. Mohosho. I'm from Bloemfontein in South Africa. I'm practicing as a gynecologist, both in private and academic institutions. I really want to thank the rest of the institution, from the mentors to the LAPA systems, not to forget the security guards who opened the doors for us when we come back from work. That was special. We never had that. If you look at the whole structure of this institution, I would agree with most of my colleagues. This is exceptional. This standard is nowhere to be found in the world. And I don't want to mention most of the details my colleagues mentioned, but if you can think about it, there's two most common types of teachers. And that is, one, somebody is very intelligent, and unfortunately they don't have an interest in teaching. They just do it because of some circumstances, and they end up not being good teachers. And the second type is the same. Somebody who's not gifted anywhere with the IQ, but they are very much interested in teaching. At the end of the day, the outcome is the same. They don't become good teachers. And that constitutes 98% of the teachers we get worldwide in our academic institutions. And then you have two uncommon types of teachers. And that is, one, somebody is unfortunately not gifted with the IQ at all, and two, they are not interested at all in teaching, and they found themselves as teachers. Usually this type of teachers, they don't really last. They fade off as time goes on. And then there's 1% more. Somebody who's very intelligent, somebody who's very much interested, with passion in teaching, and that is what I see as Dr. Mishra. Very unlikely you will find that 1% of teachers worldwide. They are usually very jealous. They do that, take the keys for the instruments, as we all experience it. Sit in their pocket, go home. We have never, most of us here, come across a teacher like Dr. Mishra. We really appreciate it. Having said that, there's a room for improvement in every situation. And I think one of the aims or intentions of this institution to spend this much of time to acquire the feedback from the candidates is for the institution to improve. And there are few things that you would see, and I think fairly well, statistically, clinically, academically, you are warranted to put it on the table and say, Dr. Johan, I think here we can improve there. That is their objective. That's what they want to achieve. One of the best things that I have learned during the time of this one is when we get an opportunity to go to live surgery, that is like getting a diamond just on the street, walking. You can go anywhere in the world, you will stay in that other room, and the monitor is there, and then the surgeons can go on and they can show you there with a pointer, this is where we are and this is what we do. So we get involved there. We even have clinical hands-on on the patient. That is unbelievable. We can't get that anywhere else in the world. And what I would like to suggest in one of those is, once we have been given this an opportunity to get into theater, to see these two mentors operating, I felt that this is the day I would just ask for my diploma and go back, and I think I'm enough. I had the best I could ever ask. And while they are there, we got this opportunity. I would advise them to little bit check. It happens to everybody, but you must just check how we communicate in a clinical setting. So this is an international institution. It's not an Indian institution, it's an international. That's why we have international candidates. And we would like the communication language to be at an international level. At least we try our best to be communicating in English all the way from start to the end. And I got so interested, I wanted to hear what Dr. Mishra is saying to the assistant, to the scrub nurse. I want to hear, because I'm sure I'm going to learn from that single way. But I had learned at least, boss, I learned that for now. But I think if we can try, it happens to everybody. Nobody speaks my language. Mark is from South Africa, the same as me, and I'm speaking a different home language. But I've spoken my home language to any one of my colleagues unintentionally. So it happens to everybody. But we need to see to it and we strategize with the labor systems, with everybody, that we try our best to get there to that level. Anyway, I would like to thank all the colleagues. We had a very fantastic, everybody wanted to take their bags after 3 days of that basic lecture. And then I phoned one of my colleagues. I said, my God, all the near misses, thanks God patients are alive. Because those patients, they were supposed to have died, that I've operated after I've learned that there is exactly the same thing that I was not supposed to have done. But I was taught, because I was observing, that this is the right thing to do. And from now onwards, I'm confident that I was telling my colleagues before the end of this year, I would have done a total hysterectomy. I am sure of it.